have my medication prepared, and I'm going to be entering the room and administering my parenteral medications to Miss Florence Nightingale. Knock, knock. I wait. Miss Nightingale does not respond. I come into the room for the purposes of the demonstration. I already have her bed elevated to my waist height. I will check her name band, Miss Florence Nightingale. Over the bed, Miss Florence Nightingale. And Miss Nightingale, my name is Pat London, and I'm here to give you your injections. If I have touched Miss Nightingale at all in that process to prepare her ready, I would Purell or hand sanitize my hands before I do my third check at the bedside, which I will do now. So systematically, I will come to my first 5 o'clock, and that is insulin. I have my syringe marked. I have Demodos NPH insulin, 3 units, sub-Q before breakfast and supper at 5 p.m. It has not been given yet on the 10th for Miss Florence Nightingale. Then I have my next one is the mini vial, Demodos mini vial, 0.1 mils intradermal every year at 5 p.m. It has not been given yet for Miss Florence Nightingale. And I have my next 5 o'clock is Demodos multi-strength powder, 0.6 mils intramuscularly every day at 5 p.m. It has not been given yet for Miss Florence Nightingale. I do look across to see the sites that these injections have last been given, and I will choose the site that has not been used or is part of the rotation of the site. For the purposes of this demonstration, I am going to be using a demo pad for both my sub-Q and intradermal. And the order in which you do this is not important. So I'm going to put my gloves on, locate my site, circle from the inside out. I'm going to lay my cotton swab there to point to where I've cleaned my site. Let the alcohol dry. And I'm going to begin with my insulin injection, which is a subcutaneous injection, holding it like I would a dart or a pencil. I am going to bunch the skin. I can feel the subcutaneous tissue. I'm doing that for 2 reasons. One, so I'm sure I'm in subcutaneous tissue, and secondly, so that the skin is taut so that the needle doesn't hurt when it punctures the skin. These needles are so fine, but if you want to be sure the point of the needle goes in first, you can have the bevel buck on this. So 45-degree angle. I can let go of my skin, inject, bring my swab over, hold the skin down, and put pressure. So for 2 reasons, we have this swab right over next to the needle. So I'm going to hold the skin down. I can massage my insulin, and right away I'm going to do something with my needle. I don't have a safety on this needle, so I'm going to put it right into my foam block. Even though my biohazard container is right here, I'm a little uncomfortable reaching across to get this in at this point in time. So when I clean up, I'll take the block right over there and put it into the biohazard container. That's a subcutaneous injection. Because I'm working with Miss Nightingale, I'm going to leave these same gloves on. I'm working with this same mini pad. And this injection will be the intradermal injection, clean the site. I'm going to leave this alcohol swab pointing to where it clean because I do take my eyes off that site. However, I will not do anything after I give this intradermal injection. I just leave it. If there's a tiny bit of bleeding, which sometimes that will happen, you can use your swab to just brush over the top to remove that. We generally don't put Band-Aids on these intradermal sites. At some sites that may be a procedure that they use to put a Band-Aid on, but generally we do not. If there were some bleeding, you might want to do that. So on this one I want to be sure that my bevel is up. Your CBE does not say this, but I recommend that you taut the skin, and again, that's for ease of entry. I'm going to go in just 1/8 of an inch just to cover the bevel. I should be able really to see my needle. Inject, and I did get a bleb, but it popped right away. So I'm going to inject some air here so we can see oops, there is a little one there. Okay, so there's a nice little bleb there for that one. And for these, we just have to break them. And again, the next thing I'm going to do is take care of my needle. For the IM injection, I'm going to demonstrate on the vastus lateralis site because we will not be injecting liquids into our mannequins. I'm going to discard the liquid, and I will just inject air, and I'm going to walk around to the other side of the bed. Come with me, please, so that we can show you this vastus lateralis site. And wouldn't you know, I got around here without an alcohol swab, so if you will excuse me for just a minute, you can keep your eyes right on this site while I go and get an alcohol swab. Okay, back again. That wasted a little bit of time, so I'm not real proud of that. Vastus lateralis site you'll learn how to find. I'm going to put one hand right at the thigh area, one hand above the patella or the kneecap, and within that range, right in the middle of that muscle, I'm going to put my injection. Clean from inside out. Mark my syringe, or mark my site. Taut the skin. Inject using a darting action. Aspirate, which is what we're teaching you to do. I did not get any blood. Yeah, I felt a tug on my needle. Inject, bring my swab over, hold the skin down, massage, and the next thing I'm going to do is put my needle into the block. So, because my block is on the very other side of the bed, I don't want to walk anywhere with this needle unprotected. So I'm looking around for another biohazard container, which I'd have a little walk to get over there too. So I have myself in a bit of a pickle here. In order to not be walking with this syringe, I'm going to recap, which we generally do not do with a contaminated needle. But in this case, because I have boxed myself into this situation, that's what I'm going to do. So, come with me, please. I'm walking around to the other side of the bed. And I can now dispose of my syringes in my biohazard container. And I will clean up what I have here. And now I'm going to do my 6th rite, and that would be to document. So I will document my initials next to each one of the medications I have given. And in this case, I'm going to document the sites of each one of my injection. In this particular system, at the very front of this MAR, there's a little chart up here at the top that gives you a coding. So for example, for my intramuscular injection, I use the left thigh. And so that would be a number 1. So in this system, in my site, where I've given the medications, I will be charting for the multi-strength, the site, and I will put a number 1 in there. So the next nurse coming along knows where the last injection was given. I will do my standard steps now, make Miss Nightingale comfortable. For example, give her call light in place, be sure her bed is in low position. And that would be the end of this demonstration.